The Red Cross War Memorial Children's Hospital is the only dedicated specialist children's hospital in sub-Saharan Africa. So we are treating some of Africa's sickest children here. And in 1994, the hospital was under threat of closure because of lack of funding. And that is when the Children's Hospital Trust came into being over 18 years ago to try and help the hospital to continue running.
One of the light bulb moments for me, when I walked in, the paint was peeling off the walls and there were holes in the floors. And when you don't see the paint peeling and the holes in the floors, you know your son needs to be here. And I never noticed again until he started to get well. And then I became obsessed with changing it.
This hospital stands as a centre of excellence, not only in our province, but most certainly in our country and in sub-Saharan Africa.
The Trust has helped keep the hospital on the forefront of paediatric healthcare, not only in the country but on the continent. And that's through fundraising for the major priority capital, equipment, training and research needs within the hospital. Why we love the Breatheasy project is that it's the type of project which takes children out of hospital and back home where they belong, and also at the same time builds the capacity of the parents to be able to care for their children and allows children to continue leading their normal daily lives.
Whether you are rich or poor, the dream of any parent is to get your child home.
A mother's care being key to a child's health, and of the importance of children being able to go back to their communities and have a fulfilling, good life. Children were 8 times more likely to die in an institution than at home.
The Breatheasy program is now an official program that manages children with tracheostomies and home ventilation.
The fundamental issue in primary healthcare is where the power lies. Shifting power from the professionals and the complexity of equipment into the household and into the family and into the parents.
We were in and out of hospital, and it was very difficult for us because we had to go to work during the day, and then in the evening we had to come to a hospital. And the doctors told us no, she needed a trachea.
Breatheasy was magnificent for us because this is what saves our kids' lives. This is what allows them to breathe.
If somebody has a blockage between the nose and the mouth and about over here in the windpipe, they need to have a tracheostomy so that they can breathe.
When I walked onto Jane's ward and saw how easy Jane makes it for parents and how quickly she teaches us, I immediately gained confidence.
Jane is such an encouragement. Sister Booth she was amazing for us. We could ask her anything we wanted to at any time, and she would be there to tell us. We could SMS her any time of the day. Sister Booth just made it very simple for us. She spoke to us in a way that we were going to understand.
And that is the one thing that Jane does so brilliantly, is she distills the most complicated things into a very simple explanation. And she demonstrates to parents and empowers the parents in such a simple way. And that's what she did for us. I decided to call the foundation after our son, Alexander Dylan Green, who would have been 2 this week. And he died, unfortunately, but we managed to get him home.
Alexander basically had a heart attack. Jeremy was totally prepared with resuscitation. He knew A for airway, change the tracheostomy, B for breathing, do the breathing, C for cardiac massage, but he couldn't resuscitate the baby. My advice to him was to stop everything and cuddle his baby.
We wanted to leave a legacy in his name, and the knowledge that's here at the Red Cross War Memorial Children's Hospital is unique, because although his life was short, he had quality.
The Breatheasy program enables children with compromised health to go home where they belong. And every single day in hospital is a day less of childhood, and it's a day less of family unity.
One of the principal functions that we want to provide as a foundation is funding for the education of nurses, specialist trained nurses that will replace Jane and allow Jane to replicate her program throughout South Africa and into Africa, and hopefully beyond. My own research showed me that many programs around the world are not run like Jane's program, and in the case of our child, if we'd been in Europe, I don't think we would have been allowed home.
It was interesting. I presented the early days of our tracheostomy program at our academic year day a few years ago, and there was a Dutch visiting professor from Rotterdam, and he was amazed at what we were doing. He said in Holland, they would not be able to send children home with the levels of technology that are required and to some of the circumstances to which we send children home.
I think the Breatheasy program now has the potential not only to reach into research, strengthening teaching, and strengthening services in this institution, but also to do that nationally and across the continent, where the needs of children are so great.
We're trying to assist the Trust in finding private donors such as the Alexander Green Foundation to ensure that the program becomes sustainable and also that it may be replicated in other centers to ensure access to all patients who have this kind of problem.
When you start drilling down into areas like Breatheasy, which is really specialist, which really needs attention, it needs training of the parent, it needs support, without the Trust and the Alexander Green Foundation, we simply cannot stretch on our own to get to all of these areas.
Jeremy's passion in establishing the Alexander Green Foundation, from the first time that I met him, I felt there was a kindredness that although I had my son and he didn't have his, we came from the same place. We wanted to say thank you. And I will do anything that I can to support this, and I would ask that every other person from a privileged background who is able should give.
No child should sit in a hospital because of this condition, because it's not necessary. We've seen it, and Jane has proven that.
When you look at the work that Jane does, it is an incredible solution that provides so much to so many for so little. It's an African solution that really should be recognized as a way forward for medicine around the world.
Together with the Children's Hospital Trust and the help of the provincial government and other stakeholders, we need you to help fund this program.